Let's look at some realistic treatment options for the vascular system. So, first of all, we follow the logic, the way it developed the system, and also the logic of physiology. So, we start in the periphery, that's where the volume is. So, the volume in the beginning, in an embryo, the volume is blood. The first there's blood, and then there are blood vessels and there are blood organs. So the whole story of the liver is basically this kind of story from the lacunas of blood. Then there's the liver, and then there's the venous fullness. So we start in the periphery. The issue is volume. Yeah? These are the important mechanical words. Yeah, you have to hear when you talk about vascular treatment. Yeah? So volume is the beginning, yeah? And then there's it moves from the venous to the arterial system, and the mechanical word you need to hear in the if it comes to the arterial system is pressure. So whatever differences you learn between the venous and the arterial system, yeah, that of course it's relevant, but these are the mechanical words, yeah, volume and pressure. And so that's also the reason why we treat volume organs like the liver very different than pressure organs like the kidneys. Yeah? So the kidneys are the embodiment of pressure. Yeah? So they create blood pressure. They are very stable in their form. And everything about the kidney is about stability and the arterial system. Yeah? They have a sense of place. They are because they are stable in their place, and they are about stability, and the stability is because of the arterial system and their warmth. They have a fat bed, and the fat in the around the kidney is special because it produces heat, so it's a thermogenetic fat. So it's important. These are the three major things you have to say about the kidney. And if you study the kidney anatomy and physiology, it's very clear. It's one of the most stable organs in its form. Its artery is on the left is very short, very stable, and it actually is even supported from the outside by a special fatty tissue. So everything talks stability in the kidney. And if you want to have a kind of a systemic view on how you work with the vascular organs, this would be kind of working with the volume into the pressure system. So first there's blood, first there's substance, then there's lacunas of blood, and then there's the organs. And the first organ is the organ of venous fullness, that's the liver. And then the blood moves into the venous arterial balance of the heart. It makes venous into arterial blood in terms of the pressure, from volume to pressure. And then we move from there into the arterial organs, and that's the kidney and the spleen. Yeah. So this is kind of the logic, the inherent logic in the blood system of the organs. Yeah. So this is one way we're going to work with organs. Yeah. That's also the way we look at the characteristics of the organs. So the blood volume, it's the C, it's the substance. Yeah, you're coming from a lot of volume, a lot of water, a lot of from the sea, from the ocean. And then there's flow, and then the flow is because there's pressure and distribution. The heart can do this. So then I put you all the embodiments from the artist in the bottom there. So the heart pressurizes the blood and distributes the blood. And then there's the spleen that actually is responsible for blood cells, for separating and for individuating the blood cells, because it breaks down some of the blood cells, and it decides which blood cells should be terminated and which would keep going. And some of the blood cells are maturing in the spleen, so it's an organ of individuation, of individuality. And then there's the organ of control. Everything is inside. The kidney keeps everything inside. It stabilizes itself, and it stabilizes blood pressure, and it activates blood vessels. So this is kind of the way you look at the whole volume organs of blood. Then, of course, we also look at the regulation. So it's never only one thing, but first you have the organ, then you have the regulation. So we look at the receptors for blood volume and blood pressure. So like in the neck is an important one. And then we look at high and low pressure baroreceptors. So this is important. So you know where the organs are, you know where the regulation is, And then so you can look at a system. This is more or less a system because it's closed, because the blood is not lost. So you can actually call this a system. We can, so what we always do is we look at the organ in itself, we look at the organ in connection to other organs, and then we look at the regulation, and then we look at also bigger context, like for those who ever done yoga, so or who do the chakra work. So there's a whole idea of the snakes along the spine, and it's interesting because this is also a representation of the kidney energy along the spine. And in homeopathy, we have a lot of good remedies that are actually made out of snake poison for the kidneys. So this is just one. I just picked one interesting context because the kidneys are also the organs for the spine. Okay, so this is realistic osteopathy. One was for the organ system, for the vascular organs. Now we'll do the same for the lungs, for the lung system, for the breathing system. So realistic would be to realize that you are basically starting from the periphery. The periphery is 90 to 95% of the lung itself. So you work from the crown to the stem. I just put the tree upside down, so we have to reverse the logic. So you start with the periphery, and then you go to the stem, and then you go to the large bronchi. So just remember, keep in mind and in your hands, when we do now afterwards, when we do the palpation of the lung and also treating the lung, it's a little bit like I'm wearing a wig. So you're touching the hair, you're touching the periphery, and you're trying to place basically the wig, the hair on top of the head. So I will use a lot of images, basically the crown on the head, or the periphery on the stem. So I'm going to use a lot of these different kind of images, also the microphone, so the periphery and the stem. So this is important because we're going to work on the periphery, and the mantra I will be using all the time is basically stay on the edges. So if you treat these organs like from the periphery, you have to stay on the edge. And why are we doing this? There's one very important equation in lung physiology. It's the first one. I guess if you had a good physiology class, then this is the first one you would learn. It's the equation that actually describes gas exchange. So gas exchange is possible because of two things: ventilation and perfusion. Here you can also understand why the focus on ventilation has nothing to do with gas exchange, because you can ventilate as much as you want. If the perfusion is not happening, it's not gonna work. So please keep in mind this equation, but the reality behind this is it's a relationship. Now it's not one thing. So ventilation and perfusion. Perfusion is basically vascularization. So in the lung, there's a meeting of air volume and blood volume. So I try to do this. I try to explain that in different kind of articles. The problem in the pandemic was that people did not want to listen. So I wrote a short text about the poor lungs, because there was a focus on ventilation, on forced ventilation in the pandemic, and because of the politics of the pandemic, it was not possible to publish anything about lung physiology. And my understanding is that a lot of osteopathic schools did not teach lung physiology in a way that people were able to understand what it means to ventilate a lung, to forcefully ventilate a lung. So let's state it again, because that's what we're going to use when we treat. It's a relationship between two things: ventilation and perfusion. So whatever ventilation techniques you use, they're fine, but they only influence ventilation. But ventilation does not decide if the gas is moving through the alveoli. And so these two things have to work together. In forced ventilation, so there was a big argument in the beginning of the pandemic, because it was recommended to start forced ventilation early, and one of the intensive care doctors in America was upset because he said they were told to ventilate not for the benefit of the patients, but to keep the pandemic under control. The rationale was that if someone is intubated, they're spreading the virus less. Yeah? So there's a lot of forced ventilation, not for medical reasons. And the WHO, yeah, recommended, based on some recommendation of Chinese doctors, to start ventilation early in the treatment. Yeah, that's a problem because it's early means it can be too early, and they also started ventilating based on O2 levels and saturation, and that's something that's actually not often done. No, most lung doctors would not ventilate only based on O2 saturation levels. Yeah, that's a recipe for disaster. And a lot of lung doctors actually refused or basically protested against this kind of recommendation. But anyway, it was there, and it was a lot of people followed this early forceful ventilation. One of the American, it was all over the world, but a lot of the lung specialists would point to the fact that there's a problem with early ventilation, and it has it has to do with lung physiology. And if you understand lung physiology, then you have an understanding of the ventilation perfusion mismatch, and that is a common problem in lungs. And if you don't understand that, then you really think like ventilating a lung is easy. It's not easy at all. Usually we ventilate people with healthy lungs, and that's already something you need to have a very good training to do it. But ventilating a lung that actually has a pneumonia or is in an inflammation is a very difficult thing to do. So I was teaching for 10 years people in Switzerland who are doing these mechanical ventilations, who who also support them mechanically, physically with osteopathic techniques. So it's very clear that what happened in 2020 was really a big disaster. I included these two statements. They're in German, but it's the German president of pulmonology, so it's in German. You can translate it. But he was really upset in the beginning that people were forced into this kind of ventilation techniques. So these are two statements. So what is it about? Yeah, again, it's about the relationship, and it's very interesting to study that because, for example, you then realize that that relationship is very different on the top of the lung. That's why we're breathing usually in quiet breathing into the top of the lung, and because there's a lot of ventilation there and there's a lot of perfusion at the bottom of the lung. So these things are really interesting and very helpful, yeah, in osteopathy, in when you do other kind of treatments of the lung and the breath, but you have to really get into this relationship of these two qualities. And if you only focus on one thing, and that's what I found, like in osteopathy, happened a lot, that people really think ventilation is the main thing. It's not. Yeah? So there's another important equation. It's actually, this is like V over Q. Q is for perfusion, and so it's volume over ventilation, and it's important. This is the change of volume over the change of pressure. So that's the other part, yeah, and that is the description of lung elasticity. So the change of volume in relationship to the change of pressure, that gives you an idea that the more volume you have, the more resistant the lung is. And remember, elasticity and compliance is the same, it's just reversed. Yeah? So we measure lung quality activity by elasticity, also in mechanics, in manual treatment. And this is the second one of the equations you need to keep in mind when we treat. Yeah, volume and pressure are connected, and they both basically, the change of volume and the change of pressure is in the description of lung elasticity. So this is how it looks then. Yeah, so take your time to study it if you're interested in these things. Okay, there are two people who wrote a lot about the lung. So West, I think it's John West. He's teaching at the University of California, San Diego, and I think he's not teaching anymore. But he has a lot of also lectures online, and he wrote a lot of books, many books. I just that West is best for the lung. Yeah, so really, if you're into lung physiology, he's one of the most central figures over the last 50 years. And I mentioned him before. He's one of the Swiss researcher, also worked in America. And so he did a lot on research on the lung. So he died recently, but he's also very good source to study things. So, okay. So let's work on the lung. Let's work on the vascular organs, and then see you in soon.